Hi, I'm Dr. Marc Rogers. I'm here with a good patient of mine, Teresa. Thanks, Teresa, for doing this. What I wanted to do with this short video is I want to explain a technique that I'm using on Teresa, a chiropractic technique that a lot of people might not know about called the Cox Flexion Distraction Technique. Without going into too much right here, Dr. Cox is a chiropractor in Fort Wayne, Indiana, who wrote the textbook on low back pain that I studied as a chiropractor in school, and is a brilliant man. And basically what Dr. Cox has done with his technique, and a lot of research with Harvard Medical School, other medical schools, this is used in all the military bases, Air Force bases, and San Diego, for example, have 4 Cox Flexion Distraction tables. Basically, Dr. Cox says that if you can gently apply a force of flexion and distraction extension to the low back, to the disc, you can actually increase the fluid exchange. Fluid buildup in this canal causes chemical irritation, which causes a lot of pain. It's not so much a disc on a nerve they're finding out. A lot of times it's the inflammatory chemicals around that nerve. A lot like if anybody out there has ever sprained their ankle and their whole ankle swells up and gets puffy, well, those are inflammatory chemicals as well. So what this technique aims to do is to provide a pumping action, kind of like a movement to the disc, and pump it like a sponge to get fluid in and out. So I'm gonna show you real quick how this happens. Now, Teresa's had some disc bulges down in the low back. We found out that was the case on MRI. So I know where those disc bulges are, and she's got one right in this area. And I'm going to just apply a gentle force up and down like this while I'm holding down on the vertebrae above. And what that's doing is it's pumping that disc back and forth, and it's getting a good fluid exchange. And that doesn't hurt, does it, Teresa? No. No. So she's not having any pain. There's some other things that we do for the disc, but I've seen so many cases of disc problems in the low back that this technique can help them. And a lot of people are doing drugs, or they're taking shots, or they get surgery. And I just think that if you don't try a technique like this first, that's proven, that's safe, and that's effective, I think you're missing the boat, because this is a technique that a lot of chiropractors do. We do it here in the office. I've got 2 of these tables, and if you've got a disc problem, I encourage you to come in and see if this technique can help you. Thank you very much.